Welcome everyone to the webcast series, The Public Health Insider. My name is Casey Farm and I'm the Director of Alumni Relations for the College of Public Health and Human Sciences. I'm absolutely delighted to introduce the moderator for today's episode, The Silent Crisis in Rural Housing. This is the first webcast of the third season of the Public Health Insider series. We still have two more episodes for this season coming up on Tuesdays, February 16th and March 2nd, both at 4 o'clock. You can register for these upcoming episodes and catch up on previous episodes from the first two seasons at osualum.com/public health webcasts. A couple of logistical items. If you look at the bottom of your screen, you will find a Q&A chat button. You are welcome to type these questions throughout the talk that you may have, and at the end of the presentation, our panelist will answer as many as she can before the end of the episode. Our webcast series is hosted by the OSU Alumni Association in collaboration with the OSU Foundation, the College of Public Health and Human Sciences, and the OSU Center for Health Innovation. We are really excited to return this series for its third iteration surrounding public health, what it is, why it is important, and how it applies to our lives and our communities. For more information on public health and all other incredible work that's being done within the college, visit health.oregonstate.edu. Now on to today's moderator who introduced today's topic and our panelist. Our series moderator is Dr. Allison Myers. She is the director of the OSU Center for Health Innovation in the college. The center serves as a connector between external organizations and Oregon State University faculty in the discovery of innovative solutions to pressing health and wellness issues and builds workforce capacity in public health and human sciences. In service to meeting the most pressing public health needs in the state of Oregon, the center is home to projects related to the COVID-19 response, including TRACE, which is a public health surveillance project. Other projects include mental health and preventing disordered substance abuse in rural Oregon, and other addressing food insecurity in partnership with retail store owners, local health authorities, and a coordinated care organization. It is my absolute pleasure to introduce and turn our webcast over to our series moderator, Dr. Allison Myers. Dr. Myers, always wonderful to have you. Thanks for being here.
Thanks, Casey. Hi, everyone. I am acutely aware that it's a Tuesday afternoon, maybe at the end of your day, maybe it's the evening for you, but I want to welcome us all together for Series 3, the kickoff of the Public Health Insider webcast series. Maybe a deep breath is in order. This is not your usual Zoom meeting. I do want to begin our webcast today by simply acknowledging the land on which many of us are sitting. I'm broadcasting from Albany, Oregon. Others of us are in Corvallis. Oregon State University itself is in Corvallis, and the land there is within the traditional homelands of the Marys River Band of Kalapuya. Following the Willamette Valley Treaty of 1855, Kalapuya people were forcibly removed to reservations in Western Oregon. Today, living descendants of these people are part of the Confederated Tribes of Grand Ronde Community of Oregon and the Confederated Tribes of the Siletz Indians. It's important to acknowledge the land, and I think it provides a nice segue really to talking about rural housing. We started this webcast series as a way, and Kate, I'm going to introduce you soon, so I'll invite you to turn on your camera. We started the webcast series as a way to connect with our audience during a time when we couldn't physically be together because of the COVID-19 pandemic. And here we are, it's February 2021, it's almost a year since we've been home, and we're at something like 26 million cases of COVID in the United States. We've lost almost 440,000 people, and the vaccines are certainly being rolled out. There are more people eligible for vaccines than there are vaccines available now, so many of us are being patient, hoping, waiting, continuing public health measures as we also look for hope on the horizon. And I think, for our College of Public Health and Human Sciences, it feels to me like it's an all hands on deck moment. We're all pitching in, we're all working for the resolution of the COVID-19 pandemic. And at the same time, we're reflecting on what this will mean for us, right? What are the bigger issues in public health and human sciences, in community development that are uncovered or where light is shown during the pandemic? And I think housing, quite frankly, is one of those places. So we're starting there today. And then, as Casey mentioned, we'll keep going over the next couple of weeks, talking about outdoor recreation, making the outdoors accessible to everyone, and then also about social change broadly over generations. And all of this colored and influenced by how we're living and working now during COVID-19. I am thrilled to introduce Kate today, Dr. Kate MacTavish. Kate's an associate professor in the College of Public Health and Human Sciences. Dr. MacTavish, you also lead equity, inclusion, and diversity initiatives in our college. And I hope that there's someone out there who'd like to ask you a question about that so that we can at least cover a snippet of that after your talk. You earned your PhD in human and community development from the University of Illinois at Urbana-Champaign. And your research examines how small towns and rural places function for the children and families who call them home. I am thrilled to have you talk today because it meant that it nudged me to finally get a copy of your book that I've known about since I met you when I arrived at Oregon State a couple of years ago. Kate is the co-author of a recent book, 2017 book titled Single Wide, Chasing the American Dream in a Trailer Park. I am going to let you get started and encourage our audience to make sure they use the Q&A function. Kate, so thanks so much for being here, live from Waldo Hall, and I'll hide out and you take it away.
Thanks, Allison, for that nice introduction, and thank you for the land acknowledgement, and thank you as well for bringing up COVID. So today, what I'm going to provide you with is really sort of a sweeping overview of some of the issues and challenges that come up in rural housing, and we titled this "The Silent Rural Housing Crisis." Because often those issues go unseen. We tend to very much as a society have our focus on what's happening in urban areas and not so much what's happening in rural areas. As I do that sweeping overview, you're probably going to notice that missing from that is really a solid understanding of how COVID is coming into play. I searched long and hard to try to find additional data to bring to that, but it is just emerging, and coming up as we're moving through this pandemic. So I would invite you all to really consider how what I'm presenting today might be transitioning, might be growing worse, might be in some ways perhaps transforming in different ways under the conditions of the pandemic that we're experiencing. So I'm going to go ahead now and share my screen so we can get started. If you see me looking down, I'm checking my notes to make sure I stay honest to things, but we'll get going here. All right, well, I'm going to start us off with probably a reference that you wouldn't be anticipating in a talk on rural housing. And I'm going to kind of frame this as sort of what I've seen come out of the work that I've been doing for the last 2 decades, really focusing on how families are impacted by the context of housing in rural America. And we've come up with a concept around hustle. And we're borrowing here from an urban concept. But midway through the second verse of Keeping Your Head Up, Tupac Shakur, who is an Oakland-based rapper, makes reference to this notion of trying to make $1 out of 15 cents. And it's a phrase we often hear in reference to urban environments. And what it speaks to really is a hustle that's required to survive in an environment that literally strips its inhabitants of opportunity. So it's a way of surviving, not thriving or prospering. So I want us to keep that in mind as we move through today. So as Allison has alluded to, I was asked today to speak about housing in rural America and really to sort of consider what are the challenges that are defining what we think about as a crisis. We might think about the context of rural and of rural housing as being seemingly far removed from Shakur's Oakland. Yet I'm going to argue that the premise of marginalized individuals really having to work to create opportunities for themselves within a system where supports are minimal transcends that geographic difference. I'm going to be drawing on interviews with close to 300 poor and working poor households that I've encountered over the last couple of decades and studying rural housing and family life. Most of that work has happened in the context of rural mobile home parks, or trailer parks as families often refer to them, and very often in the context of rural poverty. So hustle, I will argue or assert, is as inextricably linked to achieving housing stability in that rural context as it is to gaining economic footing in an urban ghetto. Hustle is what far too many families have to do in order to keep a roof overhead. So here we've got a graphic that illustrates the contrast between the median household income in the US and the median cost of rent in the US. And what we can see illustrated here, even though it ends at 2020, the trajectories would remain consistent, is that incomes have not kept up with rent. So hustle is what it takes, as is the case in 1 in 3 or 7 million rural households, when housing costs eats up more than a third of a household's income. For close to 3 million rural households, housing consumes more than half of their income. When a household spends that kind of money on housing, strategic efforts at trying to literally make a dollar out of 15 cents are needed in order to cover basic needs, to put food on the table, to keep the lights on, to clothe a child. So housing cost burden, which is what is defined by spending more than 30% of your income on housing, is also a major driver of homelessness. And while we certainly know homelessness has continued to expand under the times of COVID, unsheltered homelessness among families with children is proportionally highest in rural areas, something we don't often think of. Doubling up, which is a hidden form of homelessness, or becoming housing dependent, that means literally shacking up with someone more out of necessity than love, is a kind of hustle that's employed to counter that threat of homelessness. Hustle is also what it takes when confronted with substandard housing conditions. So we have made dramatic progress in the last half century on housing quality in rural areas, yet the Housing Assistance Council estimates that 30% of rural housing is still substandard, meaning it lacks basic amenities like complete kitchens or complete plumbing. It may have a leaky roof, broken windows, or a sagging porch that all indicate structural concerns. So within that context, rural families hustle by attempting to store things outdoors. Perishables get stored outdoors in the winter. Families barter for repair work on their house. They cut back on other essentials in order to help pay for repairs. Or they employ strategies like having everyone sleep in the living room next to the wood stove in order not to have to run the heat in peripheral rooms that might have broken windows. Hustle is also necessary when daily life takes place in the context of concentrated poverty. The share of rural counties with a poverty rate of 20% or more have increased from 1 to 5 or 20% in 2000 to close to 1 in 3 by the time we reached the average between 2011 and 2015 on the American Community Survey data. The share of the rural proportion living in an area of concentrated poverty nearly doubled in that time. Managing to maintain some kind of stability, much less achieve any kind of upward mobility, takes hustle when opportunities for accessing a job, gaining an education, and ensuring the safety of children are challenged, as they often are in areas of concentrated poverty. So combined, these central issues around rural housing, they're often unseen: affordability, stability, quality, and location, run along lines of geographic and sociocultural marginality. And what they do really is dispossess far too many rural Americans from access to the rights that are ensured in our national housing goal, which is included in the US National Housing Act that was first passed in 1949. And in that act, there's a promise made that we will ensure a decent home and a suitable living environment for every American family. The kind of disposition that we're talking about has deep implications and long-term consequences for the health and well-being of rural people and places. And here we really see the connection between housing and public health. So housing stability, whether defined as frequent, or housing instability rather, whether defined as frequent or unexpected moves or stretches of homelessness, has been linked to compromised social development and compromised academic outcomes for children, as well as diminished mental health across family members. Housing is really about more than just bricks and mortar. Research has also shown that poor quality housing affects children directly through exposure to toxins, mold, lead, and other forms of toxins, as well as vermin, and indirectly through heightened parental stress. Research has also shown us that the negative effects of living in an area of concentrated disadvantage compound over time through leveled prospects for educational attainment and diminished lifetime earnings for families. So what I'm arguing might run counter to your perceptions of rural housing, and that's understandable. By many measures, rural Americans do appear well housed, and they indeed are better housed than they have been in our nation's history. For example, rural homeownership rates continue to exceed national rates, with a significant proportion of rural homeowners owning their home free and clear of a mortgage. Further, rural homeowners pay substantially less for housing than do their urban and suburban counterparts. That's a trend that holds for rural renters as well compared to urban and suburban renters. So such patterns might actually suggest that instead of a rural housing crisis, we may have a rural housing advantage. Yet closer examination makes clear that any anticipated benefit of a comparative advantage in rural homeownership or affordability are compromised in several ways, particularly for low-income and racial minority populations. So looking at this homeownership advantage, we can see that the numbers are higher, and they have been higher for decades. Despite a decline after 2000, we still see that close to 72% of rural housing units are currently owner-occupied. That compares to an urban average or a national average rather of about 67%. Those differences in homeownership rates, however, are largely explained by the significant contribution of manufactured housing. Nationally, manufactured housing accounts for about 7% of our housing stock. In rural America, it makes up about 17% of the housing stock. And that 17% holds true for Oregon. If we look at Oregon in terms of rural Oregon, if we look at Oregon as a whole, the rate is at about 7%. Okay. Here we can see a map showing us sort of the concentration of manufactured housing across the US. So despite efforts to advance today's manufactured housing beyond the trailers of a bygone era, there remain structural, financial, and social insecurities that continue to erode the benefits, the ownership benefits of this kind of housing. A lot of that is what we talk about in the book Single Wide, and I'd be happy to delve further into that during the Q&A if needed. Second is the trend across the nation as a whole that ethnic and racial minority groups do not realize equitable opportunities for homeownership in rural and small town America. So ownership rates among rural minorities are higher than in urban areas, yet they tend to fall about 20 points below what we see for rural non-Hispanic whites. So we can see in this graph that we've got rural and small town homeownership rates here, which are higher than the national average. But we can also see that if we look among the different minority populations down here, we certainly see that those rates are falling below. So we have some equity issues around ownership or any kind of ownership advantage for sure. Finally, another aspect of ownership that becomes an issue or creates some challenges is that the almost singular focus on home ownership as the ideal in rural America really leaves out the needs of the over 7 million folks who are renting their housing. Those are folks for whom ownership continues to remain out of reach or for various reasons is not of interest. So their needs often go overlooked. Another area we can think about possibly having a rural advantage in housing would be affordability. But rural housing has long been assumed to be more affordable. And in actuality, rural homeowners pay about 40% less on average per month for housing than do their urban or suburban counterparts. Yet if we think about comparative costs really only tell us so much of the story. I've already mentioned housing cost burden, the rate of income to housing costs as a better indicator of affordability. The map here illustrates the national distribution of cost burden. Overall cost burden has grown worse in recent decades. And the things that are emerging about the impacts of COVID on housing are showing us that those housing cost burden rates are continuing to persist as an issue and even grow worse in rural areas. So we can see the areas that are indicated in red, of course, are the areas where there is significant housing cost issues. Housing cost burden really hits those renters that I was just mentioning hardest, where nearly half of them are showing up as being severely cost burdened. So what we can see here is that these are renters versus owners, and we can see certainly the proportion of rural renters as being hit quite hard with housing cost burden. So the housing affordability gap is particularly clear if we look at renters in particular, where we really talk about that as being the place where we see people in the place of pinch. So the affordability gap is particularly clear if we think about extremely low income renters, and in particular, a trend that prevails, that is a trend that prevails in rural as well as urban America. So some folks have said that we traded some of the structural issues that defined the challenges in rural housing in past times with affordability issues that are shared with urban areas as well. I'm always struck by the fact that there was this declaration made in 2017 that every US county has an affordable housing crisis. So there is essentially no county in the US that has sufficient affordable housing to meet the need for affordable housing in the US. So why do we see these disparities? In public health, we always like to talk about what are the upstream things that come that cause us to see the kind of outcomes that we're seeing in context. So, and there's that famous story that maybe many of you know about sort of the babies in the river and the need to sort of look upstream to be able to figure out what's happening, who's throwing the babies in the river in order to stop the babies from drowning in the river, rather than doing more proximal solutions of trying to save the drowning baby that's right in front of us. So what's throwing rural America in the river is where I'd like to go next, and sort of look at what are those upstream causes of the kinds of issues that we're seeing in rural housing. And there are a number of those. One is really these diverging trajectories of growth and decline. So we know there is no one rural America, right? There is a diversity, and we certainly see differences between subregions in the US. Some rural scholars talk about 3 rural Americas that we find in place today. One of those is amenity rich and growing, and you may be able to think about the places in Oregon or in whichever state you're in that would fit into that category. Another are rural places that are in decline. And a final is rural places that have persistently struggled with poverty. What's happening in those 3 places is quite distinct. So we're going to run through that in a minute. The housing issues that are emerging in places of rapid growth contrast really dramatically with those in the areas of economic and population decline and stagnation. And alongside those uneven patterns of growth and change come recent trends in mortgage home finance, sort of our second upstream category. And those have heightened vulnerability, particularly among specific populations and places, as we'll take a look at in a moment. Finally, there are shifts in federal support for rural housing. They're adding layers of complexity to contemporary rural housing opportunities. And we'll take a look at those in the slides to come as well. All right, so taking on those first, thinking about population growth and decline as upstream of this need to really hustle in order to keep a roof overhead in rural America. Much of the growth in rural housing happened in high amenity and exurban areas where private sector-led development responded to emerging markets. In recent decades, recreation counties in the US grew at a rate of 20%, 3 times the rate of what we found in other or across non-metro areas more broadly. And for those of us in Oregon, we probably recognize this county that's in the center of our state, Deschutes County, where Bend is located, and certainly what I've just described would be a pattern we've seen happen in Bend. Such development really does open up ownership opportunities because we see a new stock of housing being added. Seasonal and second homes are common in these high amenity places. Yet such market-driven development profoundly affects the housing opportunities of those of lesser means, either those who are currently in the community or those who may be attracted to the community in order to work. While tourism-based economic growth creates jobs, those jobs seldom, as we probably many of us know, seldom pay a wage adequate to afford housing, let alone homeownership. It's a story not unlike what we see with urban gentrification, where low-income residents, families and children in younger households are least able to afford the escalating land and home prices, where either pressed by a situation of shelter poverty or pushed towards other options, those families find it hard to be able to stay in place or enter into place. Some turn to cheaper and insecure manufactured housing as a solution. Others double up in overcrowded situations, which we know during a time of COVID is particularly problematic. And others relocate to a nearby town where the commute may be long to work and often made a little more dangerous by winter weather. All these choices potentially compromise the quality of life. Amenity-driven development has slowed during the Great Recession, but it is predicted to persist as the lure of open spaces will not be denied to those who have the means to purchase or to move into these contexts. A key task here is finding ways to keep housing opportunities open, not only for hotel housekeepers, but also for school teachers, Main Street business owners, and even young doctors who may be desiring to live within the community. Without some kind of balance, high amenity places have the possibility of becoming balkanized into context of the served and their servants, with all the attendant inequalities inferred there. All right, next are these places, these rural regions that are in close proximity to metro areas. These regions have also experienced dramatic growth and subsequent change in their housing opportunities. Exurban development has really emerged as a leading form of land use in the US. Today, 39% of the nation's total housing stock falls within what is termed as the wildland-urban interface. There is rich ethnographic descriptions that illustrate how small towns are transformed by the arrival of newcomers seeking access to school, safe communities, and a home worthy of their status, but who have little interest in the broader community. What we see in places of rapid growth like this are tensions that emerge between old timers who feel their hometown becoming a non-town, a place where civic engagement among newcomers is limited, and differing priorities and allegiances essentially bifurcate the community. The loss of affordable housing in some areas has resulted from exurban development. Also brings with it sort of this threat as land values escalate. Folks who may be owners of the more affordable type of housing may be pressured to sell that land for what is often termed higher and better use. So a big issue across rural America in recent decades has been the rampant sale and closure of mobile home parks, which is our leading source of naturally occurring affordable housing. And we've seen that make headlines quite often. Outside these areas of amenity and exurban growth are those rural pockets of social and economic decline. So population loss in these areas impacts the local housing stock as well. Absentee home ownership becomes commonplace as folks need to move away in order to maintain an income. And older residents are often unable to maintain their homes in these places of more depressed economy. House values also decline, making mortgages and home rehabilitation loans more difficult to obtain. Meeting housing needs and other needs is made all the more challenging when low densities really spread populations out over large territories far from any kind of centralized resources. In some declining rural communities, the availability of low-cost housing does attract newcomers who are often disproportionately non-white and or low income. Once again, ethnographers have done some great work documenting the experience of, for example, urban poor Black families who, in search of housing, make the move from urban areas like Philadelphia out into rural areas of Pennsylvania. They're drawn by the readily available and often subsidized rental housing and a chance to leave the troubles of the city behind. But once they relocate, such families often struggle to find work, and they're often as well met with resistance from long-term residents. Differing norms and values about property upkeep and lifeways can create serious antagonism and make a community into really a contested territory. In a desperate attempt to hold on to a sense of place, longtime residents can turn to local ordinances and exclusionary policies, such as the limitation of number of cars or people per household, that really make the context an unwelcoming place for those newcomers. The spatial concentration of poor and working poor families in a declining rural area also works to create the potential for the emergence of rural ghettos, where really the compromised quality of life becomes intractable. The relocation of low-income families to dying towns where work is hard to find really perpetuates the persistence of poverty in those places. Social exclusion creates stubborn barriers with serious implications for the life chances of children and families. Thus, housing opportunities seemingly made available in declining rural areas are not without complications as well. So that was about our diverging trajectories of growth and change. Now we're going to turn to consider rural home finance and mortgage markets. So many of you have probably heard about food deserts, but there are also banking deserts in rural America. In recent decades, home mortgage finance has become both harder and to come by and costlier, especially in rural America. In 2010, which I realize was a full decade ago, 11% of the rural home origination loans were high cost, a proportion twice that found nationally. Those high cost lending increased considerably in recent years, particularly in areas of persistent poverty, where 1/3 or more of all new mortgage loans are high cost loans. Part of this has to do with declining competition as the number of rural lending institutions diminishes, and the additional cost of doing business remotely makes rural mortgages more costly for borrowers. However, it's also the increasingly active nature of subprime and predatory lenders in non-metro areas that contributes to this as well. So here's our map of APR is high APR lending, of course, is what we're speaking about here, and we can see where that falls with the dark blue here indicating that almost all of the 2/3 to 100% of the loans given out in those areas are high cost loans. So anything blue or even green is a bit concerning. There's clear evidence as well that this kind of subprime and predatory lending disproportionately targets low income and minority rural populations. This is often referred to as redlining, something that we've heard a lot about in recent times in thinking about wealth accumulation across different race and ethnic populations. So this is termed redlining in reverse, where subprime and predatory lending opens up avenues for credit to rural populations previously denied that chance at the American dream of homeownership. This chance, however, comes with significant costs. In addition to higher interest rates, predatory mortgages include abusive conditions, such as prepayment penalties and thousands of dollars that trap borrowers into an expensive loan contract. with little consideration given to whether or not the borrower has the capacity to repay that loan, especially in the face of a potential job loss or another sort of crisis. And those kinds of things then can cause a disaster or spell disaster for a homeowner who's got a subprime or predatory loan. At least one recent study has established a link between high cost loans and rural home foreclosures. While rural evidence is limited, urban studies do find that when subprime lending and foreclosures are spatially clustered, the impacts are magnified. Acorn, an activist group, has documented how economically distressed urban neighborhoods are stripped of equity, how home values decline, and how hard-won gains by minority homeownership are lost through predatory lending. So we can imagine how that echoes through rural areas as well. Finally, we have a shift in public investment. So federal investment in rural housing has been on a diminishing trajectory for decades. These declines began before the recent recession, or the last recession, and have certainly continued through present day. In the mid-1990s, the direct loan program, which was regularly funded more than 20,000 affordable mortgages a year, that number now is cut to about 10,000 a year, and it's continuing to drop. Programs assisting very low income households, primarily elder homeowners, repairing their homes have also seen declines as well. Economic need leaves governments pulled certainly in many directions, and the focus in recent years in particular has not been on rural or affordable housing. So as this quote exemplifies, federal rural housing policy, especially in the critical areas of affordability, in providing for rental markets, as well as construction and preservation aids, and addressing issues of homelessness, are narrowing and have largely been left to the nonprofit sector to address. So in conclusion, by the numbers and by the stories that I have seen emerging in rural America, the promise of our National Housing Act, which was that every American would have access to decent, affordable housing, is not something that we've realized even more than half a century later. Private sector-led development and free market home finance approaches have largely failed to ensure the provision of affordable housing in a decent environment for every American family. Yet housing is not only a private sector commodity, but it is a public good. If we think about what I illustrated earlier, that the research shows us in terms of public health outcomes from housing. Essentially, really housing is essential to economic development and to public health and well-being of our nation. Public policy has been critiqued recently as operating from an ethos of individualism and competition, wherein the state falls short of fulfilling obligations to ensuring equitable opportunities. Under such an approach, it is said that rural housing has come to serve as a visual proxy of underlying economic disparities that exist across rural America, as illustrated here by these two very different images of housing. The challenge in addressing housing inequality looms large, as the integration of rural America into the global economy will continue to move forward. And our ability to respond to that challenge will rest squarely on our collective response to one single question that is posed by Matt Desmond, sociologist who is the author of Evicted. Do we believe that the right to a decent home is part of what it means to be an American? Our response to that question is critical to rural America. As James King, the president of FAHI, a collection of nonprofits who work very hard to address issues of inequity in rural housing. The stakes are very high in rural places. If we don't figure out some stuff out, people and places shouldn't be disposable. And with that, I will welcome Allison back. And we can start the Q&A.
Kate, this is all of us on the other end of the line, like offering you our applause and gratitude. I have learned a ton in the last 40 minutes and have appropriate scribbles all over the place with a set of questions, but this is also when I remind folks on the line that there is a Q&A feature. It's at the bottom of the Zoom window, and please certainly don't be shy. We'd absolutely love to hear from you. I want to like give you a second, Kate, to like take a deep breath and get a drink of water. One of my first questions is, where's the golden thread? I go right to this place of like, what are we going to do about it? And especially when I think about, all the time I'm going to Newport, Tillamook and Lincoln counties on the coast for work, for some of our mental health work. And that is the place for me where I see that you have this growth in tourism, there are jobs, but there's nowhere to live. And so I think to myself, let me make sure I say this right. Is there a middle path, a kind of thread between encouraging tourism or recreation or some sort of economic development in rural areas, right? Because I think we know that can be helpful, versus pricing folks out and there not actually being any housing. Like, what are your thoughts on that? Am I naive to think maybe there is a middle path?
No, I'll say that I love it that you're raising that, and I think that's one of the big questions that folks are grappling with. Folks concerned with housing, for sure. I think a piece of that is, back to that question by Matt Desmond. I mean, do we really think that housing is a basic right, is a basic need, and are we willing as a society then to kind of step forward, or as communities to step forward and try to ensure that we have that available, rather than leaving it all up to the private sector to respond to? So there are communities that are doing some innovative things. One example is Boulder, Colorado, I guess, where we can think about that as being one of those extremes in terms of recreation. And they were seeing certainly the working folks in town being priced out. So they have gotten into the business of providing housing municipally. So they, as a part of that effort, they have purchased some of the mobile home parks in town and are running those. And last presentation I saw on this was kind of cool, because they sort of had it like buying up a place where buying up a park, but ensuring that folks had entry level into that. So keeping the most affordable, but also creating pathways for people as they're ready to be able to trade up to move into something that's more energy efficient and in the long run more economical, and then even being able to through the sale of that then step into a site built house eventually. So I think the fact that they're owning the land underneath it helps to control those costs of housing. So we see that happening a little bit with nonprofits getting into the game in Oregon. So in Oak Ridge, Oregon, for example, St. Vincent de Paul has taken over ownership of, last time I was down there, it was 3 of the mobile home parks in town, and are really working to try to ensure that as that becomes more of a tourist economy, there's some sort of affordability still there.
Is this related to some of the work in Southern Oregon that you might want to tell us about?
Yeah, so I have been trying to get something going down there, but we talk about a tough research context in the midst of a pandemic, post disaster, after the fires really devastated talent in Phoenix and areas of Medford as well this summer. Early in the fall, I guess it was early September. Folks are really struggling down there. So that's a case where we saw the affordable housing in those small communities, which are right adjacent to Ashland, which is one of those high amenity places. Vacancy rates are incredibly tight down there, and now the main source of affordable housing has essentially been wiped out. It's also a case where that is one area of the state where the proportion of investor ownership of those manufactured home communities is quite significant. So there's some real questions about whether or not folks will come in and rebuild, or if we've just lost that. Also, in that kind of tight housing market, for families in particular, you can't wait around for 2 years.
Right.
for some kind of housing to come back. So it's just, I know those towns are very committed to trying to keep their population that were displaced part of the community, but they're really faced with some challenges.
Oh, I love it. We've got a question, and that was perfect timing. I'm just going to try to read it the best I can. Okay, Kate, you ready?
Right. Yes.
In the late 70s and early 80s, I worked for the Farmers Home Administration, making direct loans for rural housing and grants for home repair, along with other rural direct lending. During the Reagan presidency, the move to privatize everything in the government led to FMHA selling off Farmers Home Administration, I believe, selling off many of the direct loans and converting most of the direct lending to indirect loan guarantees through private lenders. This was the beginning of the end to adequate rural home financing. Thank you so much. That's one of our regular listeners to the webcast. I recognize your name, and it thrills me to see you here. Kate, I'd love your comments or reaction to this. And, you know, we can't help but remember that we've got a new administration. And so maybe you could comment on some of this work in the 70s and 80s and then bring it forward. Maybe you have expectations that you want to share about the current administration.
I like to try and remain optimistic, Allison, but I think it's a case we're going to see. Thank you for bringing that voice of experience in, and absolutely that's what we've seen, and we've never come back from that, to my knowledge. That sort of private orientation. I think a lot of folks link that to neoliberalism, right? That idea that we really, even among liberals, that we still are thinking that individuals need to sort of find their own way rather than having a public role in that. Yeah, and I think that's just been devastating. There were some things about the last presidential administration essentially zeroing out funding for rural housing. I'm hopeful that we'll see something different come out of the current administration. But there's a lot on President Biden's plate right now. So I'm optimistically watching.
Yeah, great. One of the I think we'll maybe wait if there are one or two more questions, and I don't know, maybe Casey is our host. It's possible that you have a question or two to close us out. But in my work, I like to count things and measure things in communities, right? The number of tobacco retail outlets in relations to schools, because we know that matters for tobacco use behaviors. And in some of what you were talking about, these policies are leaning on old covenants, like rules on the number of cars that could be in driveways, or the number of people per household. And this metric about housing cost burden, right? That sort of contextual or composite variable in, I might be getting my epi wrong, but what that average is in any municipality. And I'm wondering if there are, I don't know if you have off the top of your head a sort of laundry list of things that us as public health practitioners need to be looking out for in local policy that either promote affordable housing and conditions for health for all of our citizens, or the opposite.
Well, I think thanks Allison for that question. And I think one of the big things is keeping housing as a piece of it, because housing is often not a part of the conversation, even though we're having, more attention, I think, pushed that way. For some reason, it's for too long been left out of the equation. So keeping that in mind, and then I think, having those conversations about the complexity of what we have happening in places. So if we make this move, if we push this lever, what are the other things that might happen? Who is going to end up winning from that transition, and who is going to end up falling further behind potentially from that transition? So really having those conversations and bringing in perspectives from more diverse groups.
It's a complicated issue. We've got another comment. I love this one. Hi, Lauren. I work for Extension in the Columbia River Gorge, and we're seeing a huge Zoom town surge. This is speaking of COVID, as folks from urban centers realize they can relocate to our sweet rural towns, and the cost of housing has skyrocketed even more. Hood River already has one of the greatest disparities in the state. I'm curious about your thoughts, Kate, on the implications of Zoom towns for rural housing.
Thanks, Lauren. I was glad to see your name pop up too, because I'm a fan of your work up there in the Columbia River Gorge. So yeah, Lauren, you're nailing it. That's what we're seeing. So some communities are experiencing this kind of Zoom town boom, and others, of course, are not going to experience that kind of boom. And I think it's something that communities need to be concerned about and really paying attention to as we think about what are the implications. So there again, it's a tough one. I think in urban areas, we failed around gentrification and controlling its impacts on people displaced, who are displaced by those changes. So I think, that's a place to really see if you can, I think extension is so well placed too, because you're so well connected across the community. How can you bring that into the conversation up there? This notion that some folks are going to suffer under this change, while you might, the bulk of the community might really be welcoming the economic gain that could come from that. So you all have experienced the whole Google thing too, though, or the Dalles did. So there are some rich lessons already learned up your way.
Yeah, I was talking about the tofurkey plant in Hood River in the Google office, like overlooking such an interesting thing happening there. We have a couple more questions. So we're at 8 minutes before the top of the hour. Lots of interest here. This is from Casey, our host. I come from one of those recreation rural communities, Florence, so Southern Coast. And even though they're struggling with having homes available for younger families, individuals, and attracting new workers outside the area, especially in medicine and law, but the local municipalities I know are feeling overwhelmed. So in your opinion, where would be the best place for these municipalities to start, and which entities, public, private, should they partner with? And this piggybacks well, because you were talking about bringing this Zoom town into the conversation. And my thought was, conversation with whom, right? How do we start to set the table as public health practitioners, extension faculty?
Wouldn't it be nice, Allison, if we had a housing expert in our extension portfolio? I've been advocating for that for a long time. Yeah, you raise a really good question, because as I said, municipalities are stretched thin. They're doing the best they can to respond and to manage, and certainly I believe have an intent on trying to be supportive of the folks that are within their community and not wanting to really disenfranchise their community members. But they don't have the finances to necessarily be able to respond. And we're just talking about the fact that the disinvestment at the federal level has not provided many pathways there. So the nonprofit sector is who's been managing this. So I think if you can tap into that nonprofit sector, that may be promising in terms of getting some leverage, some action. So CASA does a lot of work mainly around farm worker housing. But they have done some phenomenal stuff around the state. And there are other local community action agencies as well.
Thank you, Kate. One of the most important things that we do as part of this webcast series is, the audience, we're talking with alums, we're talking with folks who are a part of our college, folks who are not, who simply have an interest. And we always want to leave them with a sort of so what or now what, right? What are the tangible ways to get involved, from advocacy to lending a hand somewhere when it's safe to be out in the community? What are your thoughts on that? And I'll also add that this is a great place if we start to collect some notes on follow-up, because everyone who registered will get a little note from Casey. So we can link to places like CASA or Acorn or the initiative in Boulder that you mentioned, things like that.
Great.
Anyway,
Okay.
what do we do now?
Thanks, Allison. I think the very first thing is being aware. So hopefully folks are a little more aware after everything I've shared today. But, as some of us really appreciate rural places as a playground, places we go to recreate. we certainly depend on rural places as providing us with food, as providing us with our natural resources that allow us to live the kind of life we are. So I think thinking about the impact that we have as individuals is critically important, and who's bearing the negative impacts of providing urbanites or people from the city with the goods that we depend on. So that's a very first part. Certainly, we can take action with our vote as well, and thinking very carefully about the impacts more broadly on our state as we vote on things or think about issues.
Yeah, you meant it makes me think about where our dollars go, for folks that when you are making local purchases, right? It could often be that simple. Kate, it's been excellent. I wish, yeah, we can't solve it today, but I feel like I, for one, have a much better awareness of the history of housing, of thinking about what are the conditions that some of our people, our community members in the state, what is it that they're facing at the level of, broken windows and heating, to pricing, to availability, to just all of that, the sort of different levels of influence. I'm so grateful that you took the time. Thank you to our audience members too. We appreciate the questions and the engagement. And yeah, we hope to see everybody again in a couple of weeks. I think Casey is gonna close this out here.
Thank you, Dr. Myers and Dr. MacTavish. Really appreciate everything that the two of you bring, Allison being our series moderator. And I also learned a ton. And I come from, as Allison had talked about, I come from one of those rural Oregon communities, and it's very important to me. And I learned a ton as well. So I really appreciate that. And I want to echo what Allison also said. And thank you to our audience, as always, and their participation. And Dr. MacTavish, for your time, work, and passion. Everyone's busy, but I know you're especially busy. So I really appreciate you kicking off our third season. Thank you very much.